Chapter 11, Pharmacist-Patient Dialogues. Listening and Comprehension Exercises. Dialogue number 1. Listen to dialogue number 1. Stop, listen again, and take notes. Listen to the dialogue as many times as you need, or until you feel you have written sufficient notes and feel confident. You can use your notes to answer the multiple-choice questions at the end of the dialogue.
Hello, I'm Justine Berry, the hospital pharmacist on duty. Are you Jonathan Libster?
Yeah.
How are you doing this morning?
Well, I'm happy to be leaving the hospital and going home.
Well, before you can go home, I need to talk to you about the medication that Dr. Sorensen has prescribed. He has prescribed Aldactone. Do you know why?
Because I have cirrhosis. I have a bad liver. I guess the medicine will make my liver better.
Well, it won't make your liver better. Cirrhosis of the liver causes irreversible scarring of the liver. But what the medication will help you with is the removal of the excess fluid in your body caused by cirrhosis. Aldactone is a diuretic.
Yeah? I still have a lot of water in my abdomen, and my legs are swollen, even though I don't drink as much as I used to, and I don't eat as much salt as I used to.
It's really important that you stop drinking alcohol altogether. Alcohol is a toxin that is filtered through your liver, but in the process, the alcohol damages the liver. It's crucial that you stop drinking alcohol.
I know. That's how I got cirrhosis in the first place. I have a drinking problem. But I also don't want to have to get a new liver or die. And I want to get rid of this water in my abdomen and legs. It's hard to move and walk. How many times do I take this pill?
Well, your doctor has prescribed that you take 2 25-milligram tablets, one in the morning and one in the evening, but not too late, or you might be getting up in the middle of the night to urinate.
I'm also taking rifampin to help me with my itching. I itch a lot with this cirrhosis. Can I take both medications at the same time?
Yes. Have you had any side effects with the rifampin?
No, I'm getting some relief.
Aldactone has some side effects that you may or may not experience. You may notice that your breasts may become enlarged. Other rare side effects include diarrhea, drowsiness, and impotence. If you notice any of these side effects, call your doctor. I'll give you a pamphlet to take with you that tells you all the side effects.
Can I take it with food?
You can take it with or without food. While I have your chart here, I just want to confirm a few things. According to your chart, you're allergic to bees, wasps, shellfish, iodine, and sulfa?
That's right.
Well, I'm glad you don't eat shellfish. It's one of the foods that people with cirrhosis need to avoid altogether.
Really? Why?
Well, uncooked shellfish, including oysters and clams, is not always free from bacteria, and bacteria are extremely dangerous to people with cirrhosis.
I didn't know that.
According to your chart, you're still drinking about 2 cans of beer a week?
I think that's good. I've cut back a lot, and I'm not drinking hard liquor.
Mr. Libster, I can't emphasize this enough. You need to stop drinking alcohol entirely. You have a damaged liver that can lead to liver failure, a liver transplant, or death. I'm sure your doctor has told you this.
Well, I don't smoke.
That's good. Do you use drugs?
When I was much younger, I smoked pot, but it's been years.
I'm sure your doctor has told you that there are things you can do to reduce liver damage as a result of your cirrhosis. But just in case, let me give you important advice. First,
I know, don't drink alcohol.
Second, eat healthy, fruits and vegetables. Restrict salt, because salt causes your body to retain water. Be careful not to take aspirin or Aleve or Motrin, and stay away from sick people because your body is not able to fight off infections like you would if you were healthy.
Yeah, I know about staying away from sick people. My doctor vaccinated me against hepatitis A and B and the flu and pneumonia.
Good. I see that in your chart. One more thing. I just want to confirm your age and date of birth.
I'm 43. I was born June 28, 1964.
Chapter 11. Pharmacist-Patient Dialogues. Listening and Comprehension Exercises. Dialogue number 2. Listen to dialogue number 2. Stop, listen again, and take notes. Listen to the dialogue as many times as you need, or until you feel you have written sufficient notes and feel confident. You can use your notes to answer the multiple-choice questions at the end of the dialogue.
Good morning. How are you today?
Not so good.
Are you Samantha Duffy?
Yes. Are you a doctor?
No. I'm the clinic pharmacist, Mustafa Pastar. I'm going to take care of your medication needs today. Do you have a prescription with you?
Yeah, here it is. The doctor is giving me medicine for my hepatitis. I have hepatitis B.
Samantha, how old are you?
I'm 25, and you can call me Sam.
Sam, what's your date of birth?
May 14th, 1982.
Okay. Is your doctor Ben Whitman?
Yeah.
Dr. Whitman has prescribed Hepcera. Do you know why you've been prescribed Hepcera?
Because I got hepatitis B. I got infected after having unprotected sex with a person who's infected. I started to get sick and had pain around my abdomen. I had dark urine and I noticed my skin was turning yellow and my eyes too. That's when I went to Dr. Whitman, and he gave me tests and then told me I had hepatitis B.
I'm sorry to hear that you have hepatitis B. It's a very serious liver infection. I can tell you Hepcera will help to slow down the virus, but it will not cure your hepatitis. And this is very important. It will not prevent you from spreading the virus to others. So you need to be careful. I'll explain more about how to do this, but first, let me tell you how to use Hepcera.
Okay.
Dr. Whitman has prescribed that you take Hepcera, which is spelled Hepsera, once a day. You can take it with or without food.
How long will I have to take it?
Well, your doctor will decide that and will monitor how you're doing on the medication. It's possible that your hepatitis could worsen if you discontinue the medication. It's very important that you keep all your blood work appointments. You'll be getting your blood tested on a regular basis to monitor your liver and kidney function.
What else can happen to me on this drug?
Well, there are side effects you'll need to pay attention to. You might experience headaches, fever, weakness, and diarrhea. Serious side effects include rash, swelling, and a change in your urine amount. If you experience any of these, contact your doctor. I'll give you a leaflet for you to read carefully.
Okay. I can't believe I'm going to have hepatitis forever.
Well, if you have the virus in your system for less than 6 months, you should be able to recover. Your immune system may be able to clear up the virus. However, if you have had the virus for more than 6 months, you have chronic hepatitis B, and it may be lifelong because your body has not been able to fight the infection. Like I said earlier, it's important to see your doctor and keep all your appointments so that he can monitor your condition.
This just boggles the mind. I can't believe it.
Did Dr. Whitman explain to you the other ways hepatitis B is transmitted?
Yeah. He told me through sharing contaminated needles. Even people like you, healthcare workers, can accidentally get it if they come in contact with contaminated human blood. And even infected pregnant mothers can pass it on to their babies. And of course, having unprotected sex with an infected person. I've learned my lesson.
Sam, since you are infected, it's very important to protect your partners from the virus and to protect them from exposure to blood, saliva, and vaginal secretions. It's important that your partner wear a condom for vaginal and anal sex, and that you both wear dental condoms for oral sex. And of course, let your partner know that you have the virus. Of course, don't share intravenous needles, and syringes, and don't share razors and toothbrushes. I know this is a lot of information to digest.
Can I still drink?
I would not advise drinking alcohol. Alcohol can speed up the progression of the disease. But eat a healthy diet of fruits, vegetables, whole grains, and protein. Exercise and get enough sleep. These lifestyle changes are important.
I'll try.
Remember, Sam, not taking your medicine and not making important lifestyle changes can lead to other serious complications, such as cirrhosis of the liver, which is permanent scarring of the liver, liver cancer, and liver damage. Talk to your doctor if you have any questions and concerns.
I will. Thanks so much.
Chapter 11, Post-Assessment. Dialogue number 1.
Good morning.
Good morning.
I'm the clinic pharmacist, Felicia Arroyo. How can I help you?
Well, I need a prescription filled. The doctor says I have hepatitis C, and she gave me this prescription. I think it's a prescription for 2 things. She said I need to get injections and take capsules too. I think it's called Rebitron.
You're right. Rebitron is a combination drug of interferon alpha-2b solution and ribavirin capsules.
That sounds confusing.
I know. I'll explain it to you and you can ask me any questions you have. But first I need to get your name.
Right. My name is James Richter. That's Richter. This is my first time in this clinic.
James, what is your date of birth?
September 21, 1975. I'm 32.
Your home address?
701 Julia Lane in Williamstown.
Phone number?
876-5321.
James, do you have any allergies?
No, I don't think so. But I can't eat onions. I'm allergic to those.
And your doctor's name?
Charles Borden.
Did your doctor talk to you about hepatitis C?
Yeah, he told me that it looks like I got it from a contaminated needle when I got my last tattoo. I have 5 tattoos, and I never had any problems before. And I noticed that after I got my last tattoo, I started to feel sick, like I had the flu. I went to the clinic doctor in the hospital, and after a few blood tests, he told me I had hepatitis C. I don't use drugs or inject drugs, and I haven't gotten a blood transfusion ever. So it looks like it was the tattoo.
Did Dr. Borden explain to you how to take the medication?
He told me I need to inject myself, and I need to take a pill. The nurse showed me how to inject, and I almost fainted. I don't like needles. They make me feel queasy.
If you feel queasy, make sure someone is with you when you inject. You will inject the interferon alpha-2b, which comes in the form of prepared solution in vials called Intron A. You will inject subcutaneously or in your skin, and then you will take the ribavirin 200 milligram capsule. Ribavirin is an antiviral medication. You'll do this once a day, but make sure you do it at the same time every day. I would recommend you do this at bedtime.
That's it?
Well, it's important that you drink a full glass of water with the capsule. Ribavirin can cause dehydration, so it's very important that you drink fluids every day. And you can take the capsules with or without food. But make sure that you do the same thing every day. Also, it's important to keep both medicines in the refrigerator and don't shake the vials.
So this medication should take care of my hepatitis, right?
Well, it's not known if Rebitron cures hepatitis C, or if it prevents the transmission of the virus to others, or if it prevents cirrhosis of the liver, which is permanent scarring of the liver, or if it prevents liver cancer.
Are you kidding me? Is this medicine going to make me sicker?
Well, there are side effects. This medication can cause some patients to have flu-like symptoms and to become anemic, dehydrated, feel dizzy, nauseous, and even experience hair loss or hair thinning.
You mean I could become bald?
Like I said, in some patients it can cause hair loss and hair thinning.
Any more bad side effects?
Well, this medication has caused some serious side effects in some patients, such as depression, mood and behavior changes, and thoughts of suicide.
Are you serious?
I will give you the complete patient pamphlet describing this medication, its benefits, and its side effects. Your doctor has prescribed this medication to treat your hepatitis C because he has determined that the benefits to you are greater than the risk of the side effects, which can also include allergic reactions such as a rash, swelling of the lips and mouth, and difficulty breathing. Call your doctor immediately or get medical attention immediately if this happens.
Can I at least have sex?
Good question. It's very important for your partner not to get pregnant while taking this drug, so it's very important to avoid pregnancy. Interferon is known to cause birth defects in unborn children, so it's very important that women and partners taking this medication avoid getting pregnant while on the medication and for 6 months after the treatment is over. So please make sure you use reliable birth control and don't engage in unprotected sex.
Wow. I'm not married or plan to get any woman pregnant. Thanks for the warning. Looks like my life is over.
No, not at all. You just need to make a few adjustments to prevent spreading the virus to others and to take measures to protect your health and the health of others. There are a few things you can do, and you can begin by avoiding alcohol, which speeds the progression of liver diseases. Eat a healthy diet of fruits, vegetables, and whole grains, and make sure that others don't come in contact with your blood, so avoid sharing razors and toothbrushes and cover and protect any wounds you may get. Of course, you can't donate blood, semen, or organs, and it's always a good idea to let other health workers you come in contact with know that you have the virus.
I can't believe this. All because I got a tattoo.
Chapter 11. Post-Assessment. Dialogue number 2.
Hi, are you the pharmacist?
Yes, I am. I'm Victor Watson. How can I help you?
I need to get a prescription for prednisone.
Do you have the prescription from your doctor?
Yeah, here it is.
What is your name?
Sonia Sanchez.
How do you spell your first name? Do you spell it S-O-N-Y-A or S-O-N-I-A?
S-O-N-I-A.
And your last name?
Sanchez. S-A-N-C-H-E-Z.
Have you been here before?
No.
What's your date of birth?
1-5-49.
Okay. And your address and your phone number?
My address is 6 Moonlight Terrace in Ivytown, and my phone number is 367-7644.
What type of insurance do you have?
It's personal health. I have the card. Do you need it?
Sure. I need to enter the insurance information in our computer. Who's your doctor?
Dr. Michelle Drake?
Do you have any allergies?
I'm allergic to penicillin and eggs.
Are you currently on any medications?
Just Fosamax for my bones. I'm in menopause.
Did the doctor tell you why you need prednisone?
I have autoimmune hepatitis. Same thing my mother had. She died a few years ago after several other health complications.
I'm sorry to hear that your mother died. Heredity is one cause of autoimmune hepatitis, but if it's discovered early and treated early, it can be controlled with medication such as prednisone to suppress the immune system and to slow the progression of the disease. But it's important to be careful with the medication.
How much prednisone do I take?
Your doctor has prescribed one 40-milligram tablet per day. This prescription comes in 20-milligram tablets, so you will take 2 at the same time, once a day, and it's recommended that you take it with food.
I hope it helps me. My doctor said the good news is that I don't have cirrhosis of the liver. My liver biopsy was negative, thank God.
Well, that's good. The prednisone should help to inhibit the disease, as long as you take your medication as directed by your doctor. It will not cure your condition, and I'm sure your doctor has told you that you need to get more frequent blood tests to monitor your liver.
Yeah, she did. I've never been on prednisone, but I have a friend whose dog is on prednisone to shrink her cancer tumors. She seems to be doing fine. My liver should be getting better soon, right?
Well, you might not see immediate improvement, and it may take some time. However, there are side effects that you should be aware of. Prednisone can cause fluid and salt retention, weight gain, puffiness in the face, or what we call moon face, and high blood pressure.
Weight gain and moon face?
It can also cause osteoporosis, and patients will also take Fosamax. But since you're already taking Fosamax, that's good. I would also recommend a calcium supplement of 600 milligrams and vitamin D, both twice daily. This will help treat your osteoporosis and prevent further erosion while taking prednisone.
Well, I do exercise regularly. I go to the gym and lift weights and jog and walk around the indoor track. But I'll take your suggestion and get calcium and vitamin D, too.
I'm glad you exercise. I would continue doing that as long as you're feeling good and strong.
Am I going to need to take prednisone for the rest of my life?
Well, your doctor will determine that. As soon as your symptoms...
You mean like fatigue, discomfort around my abdomen, and my jaundice?
Yes, those symptoms and other symptoms you have may improve, and your doctor may want to reduce the dose of the medication while still controlling the disease. Every individual is different. Some will be on prednisone for life, others for a few years. Some will go into remission, but usually the disease will return if the medication is discontinued. The good news is that because you were diagnosed early and because you're getting treatment, you don't run the risk of developing cirrhosis of the liver and liver failure.
I guess I should consider myself pretty lucky.
AVN Pharma Education.